Tense and good morning to everyone. On behalf of the province of Manitoba and my colleagues, I am honored to be here with you today. I want to acknowledge that we are in Treaty 1 territory and that the land in which we gather is the traditional territory of the Anishinaabe, the Aninewuk, the Anishinaabe, the Dakota, and the Dene peoples, and the homeland of the Métis Nation. I also want to acknowledge and thank the organizers at the Thunderbird House for inviting us here today. Della Herrera of the Aboriginal Health and Wellness Center was kind enough to share with me the spirit of what the Thunder House is, and I would like to share that. The Circle of Life Thunderbird House is an open Indigenous spiritual gathering place in Winnipeg for all people. It is the traditional spiritual heart for all elders, healers, knowledge keepers, and helpers within the Indigenous community. Teachings of kindness, sharing, honesty, and traditional beliefs can be found within the Circle of Life Thunderbird House. They are open to providing guidance to those in need and support to Indigenous serving entities within our community, and for those that come from other communities to our city. Because of COVID-19, there was a need for a space and center to be set up to assist in the identification and vaccination in our area. This was done by the Aboriginal Health and Wellness of Winnipeg for well over a year that met the needs of our community. They provided a place for gatherings of all kinds, ceremonies, feasts, meetings, memorial teachings, drumming, conferences, weddings, and giveaways. Everyone is welcome. I would now like to invite the Premier to say a few words.
Thank you, Minister Lajimodier. It is an honor to be here this morning at beautiful Thunderbird House for this important announcement. The last 18 months has been difficult for many in our province. The vaccine effort over the last several months has been nothing short of monumental for all those who've been involved. Things such as super sites, which we'd never heard before, or waiting for your age to come up to be able to get a vaccine, things we'd never thought of before, long lineups to get a vaccination. All of this because Manitobans want to be able to continue on to do the things that they love. And in some of those things, they didn't all go perfectly, but there's certainly been learning along the way. And one of the things I think that we have learned well is that things go better when they're done in partnership. And that is represented here today, the partnership with the various organizations that have been involved with the Indigenous leadership who've been instrumental in ensuring that the vaccine outreach is appropriate and that it's effective in the communities that we are trying to reach has been significant. That, I hope, is a learning that will continue on long beyond COVID-19 whenever this pandemic is over, and we all wish it to be over soon, is that the partnerships that we've established and the services that we can deliver are better when we deliver them together. I want to thank all those organizations who are particularly involved in this initiative and have been over the last several months. I want to thank the chiefs, of course, Grand Chief Dumas, Mayor of Winnipeg, Brian Bowman. Thank you for accepting the invitation to be here today. You are all leaders who care deeply about the people who you lead, and you've demonstrated that over these last months, and the province of Manitoba is grateful for your leadership and your caring and your compassion. I'd now like to welcome my colleague from the Manitoba Legislature, the Minister of Health, to make today's announcement.
Thank you, Premier Gertson, for the introduction. It's wonderful to be back in Thunderbird House. This is my second visit here. My first visit was when I worked for the kidney dialysis program with the WRHA, and I had the pleasure of working with First Nations, Inuit, and Indigenous people to plan screening of risks for kidney disease in First Nation communities. And I was able to do some of that work here, so it's wonderful to be back in this building. As the Minister responsible for health and seniors care, again, it's an honor to be here. I would like to welcome Grand Chief Dumas, His Worship Mayor Brian Bowman, and other dignitaries that have joined us, and individuals who work behind the scenes to help us with our vaccination campaign. I also want to recognize the incredible effort shown by all our First Nation communities, Métis and Inuit peoples during the Manitoba vaccination campaign. Your leadership and partnership has been the cornerstone of success and has truly kept your people and your community safe through your actions. Today, I am pleased to announce that Manitoba has invested an additional $2.8 million into community urban Indigenous clinics. These resources will extend and expand their role and will increase vaccination rates against COVID-19 among First Nations, Métis, and Inuit peoples. To date, these clinics have vaccinated more than 58,000 people. With this additional funding, Manitoba's 5 urban Indigenous clinics will continue to provide support until the end of the year. The 5 clinics are Aboriginal Health and Wellness Centre and Mama Wichita Centre in Winnipeg, Portage La Prairie Renewal Corporation, Mama Wetak Friendship Centre in Thompson, and Brandon Friendship Centre. We know, as the Premier mentioned, that outreach and partnership is more critical than ever as we aim to make the vaccine as accessible as possible. For those who may find it challenging to come into a site such as our super sites to get vaccinated, these resources will go towards supporting a mobile outreach campaign. This allows Regional Health Authority staff, Aboriginal Health and Wellness Centre staff, and Mama Wichita Centre staff to go out into the community and bring the accessibility to their neighbourhoods. We know, again, as the Premier mentioned, and I stated before, that coming together as partners works. Vaccine uptake rates are 2 and 3 times higher in Point Douglas and Downtown East because of that collaboration. This level of unprecedented success is a reflection of our partnership and the value of co-leading and co-designing healthcare services with Indigenous partners and leaders. It is also a reflection of the effectiveness of the collaboration between the Regional Health Authority and Indigenous-led organizations. We are also pleased to announce that a portion of the $2.8 million will go to services with the Rady Faculty of Health Sciences Centre at the University of Manitoba, where we will be helping to hire a director to continue the work with our First Nations, Métis, and Inuit partners. Thank you all of you, for the incredible work that you're doing, both at the front lines and behind the scenes, to keep our clinics and our vaccination rates increasing. I would now like to pass this over to Grand Chief Arlen Dumas.
Tansi, anin buzun en nas komuni state, au pelegapsis kapipigis kuyan, nas komo Premier Ustagi Piayamit. Bring greetings on behalf of all the chiefs of the Assembly of Manitoba Chiefs. I want to acknowledge the Premier for his opening words and his comments. Thunderbird House is a very beautiful place. Thank you, Minister Gordon, for your introduction, and I also want to acknowledge Chief David Muñoz, who is here with us today. Chief Muñoz and his health team leads have been very instrumental in how we've been able to deal with the pandemic overall. I also want to acknowledge my colleagues who are in the room, Dr. Anderson and Mel McKinnon, who were given the mandate by the Executive Council of Chiefs to spearhead and give us the guidance we needed in order for us to be as efficient as possible. And fundamentally, everybody who's part of the Assembly, our Northern Organization, MKO, SCO, and everybody for the precedents that were set from Manitoba. I think that it's important to acknowledge all of those people, all of our health team leads, everybody who have brought their best forward to help us deal with with what it was we were doing. It's very positive for us to be able to gather here today like we are, because a year ago we wouldn't have even been able to do this. However, it's a testament to all the good work and the efforts that were brought forward to do what we're doing. I want to mention the First Nations Pandemic Response Team. I also want to acknowledge all of our allies within the provincial healthcare system who helped us achieve what we were able to achieve. And I guess because we all have a different lens, and oftentimes we don't focus on some of the stories that we need to focus on. But a few months ago, when there was national candidates all vying to be the national chief, and we were able to facilitate a meeting for them, each and every one of those candidates praised the work of the Assembly of Manitoba Chiefs, the Assembly of the First Nations Pandemic Response Team, which in turn means all of you who are here today, and how they all borrowed from the precedents that we had set so that they could actually better their regions and their areas. So it's another example of where if you follow First Nations acumen, First Nations expertise, and First Nations guidance, everybody does better. And we all need to continue moving on in that direction. I also want to acknowledge Mayor Bowman, because when the Executive Council of Chiefs declared a state of emergency on all of our collective behalfs 18 months ago, the province and then Mayor Bowman and his council were some of the first to come forward and support us on that initiative. And I believe that that collective effort has actually helped save countless lives here in Manitoba. And we have to continue moving forward. And I see Dr. Laval here. Good to see you too. But it's truly an honor to be here today. I actually had to change my schedule so I could be here and be a part of this message. And eventually I'll have to take my granny to her appointment, but she's strong. Just kidding. My granny would probably take me to my appointment. But with that said, friends, colleagues, truly an honor to be here today. And, I stand completely in support of our First Nations Pandemic Response Team and all of our valuable allies who have done tremendous work. And you can count on me if ever you need some assistance. So, thank you very much.
Thank you, Grand Chief Dumas, for your words. Very much appreciated. I would now like to call on Vice Chief David Manias to say a few words.
Dansi. Olen askemat naanots, se chiga paista tahu anotsota, hijoga nemet tahuk, kageni no getiatsak, skok, niniot, gamagan gijoga maganak, niganiot, maskigin niot visto, tatoskemenana. Nina David Monias gamagan, demet chigamagotse, ago gamagan utotse, emkio tapos kamaganuts. Asang ichisto gay ni so, ito hindi sigapa ya uta. Binigyan na utse. Thank you, everybody. I greet every one of you. I greet family and friends, citizens of my community in Michigamak, for all Manitoba citizens from Winnipeg as well. My name is Chief David Monias, Chief of the Nation in Michigamak. I am double vaccinated. This is the reason why we are here. We fought hard for our lives, literally, to be able to stand before you in a room, in a crowded room, spaciously separated 6 feet apart. About 17 months ago, when our lockdown started, on March 16, we declared a state of emergency in Cross Lake, followed by Manitoba, March 18th or 19th, around there. We locked ourselves in the community. One of the things we wanted to do was that, first of all, understand this, there's many diseases. And these diseases are preventable by wearing masks, being careful around people, washing hands. When I came here to this week to Winnipeg, I didn't expect to be here, but I'm standing here on behalf of MKO Grand Chief, Kersen Sati. I came here to meet with Minister Warden and Minister Lachimodi. We had a good meeting discussing our low water and also our Northern Flood Agreement. Met with their department heads. But I also came here to look for my citizen, Jessie McKay, who is missing right now. I spent my time yesterday on a boat searching for her in the river. And her family on the streets are looking for her. And this presented with me an opportunity to stand before you. And I'm glad it happened this way. A few months ago, I said that COVID does not discriminate. I'm here to tell you, I learned a lot from society, it does discriminate. It discriminates against the weak, against the people who have compromised autoimmune systems. It discriminates against people who are not vaccinated. It discriminates against those people. And those people pose a risk to their children who are not vaccinated. They pose a risk to their families, to their communities, also to the nation. As a chief, I'm mostly reminded about people's human rights, about the Charter of Rights, about choice. I respect that. But our people, in Inuit, in the Sinuit, we respect those rights, but we hold in higher esteem our responsibility to our children, our responsibility to our families, our responsibility to our communities, our responsibility to the nation. It's not about me, it's about my children back home. Vaccines have been in place for a long time. So those people who have or say that this is actually a plan to do something, to put a chip on my shoulder or whatever, they would have done that a long time ago already, because I've been vaccinated, our people have been vaccinated for years. Diseases come and go. You know, diseases have been there forever. And you see it rise where we're not vaccinated. But you also see the trends that they go down when we are vaccinated. This is something we can't see. And I'm proud to stand before you as mayor, as you as premier, you as Grand Chief, Dr. Lafali, Dr. Marsha Anderson, Minister, Minister. That we can only do this in unity. We can only do it together, to fight together, to protect our citizens, the most vulnerable people. And I'm happy and I thank you for introducing these funds to make it happen in our community, to fight and save our people, literally. Kinanas gamit na gagano, itamiskat na, pues, itiga pa istat na, kawityo kadimit na. I thank you. I will stand with you. I will fight with you. I will do it in partnership with you, in unity, to fight this disease, to fight this virus, and to protect our people. Thank you very much.
Well, thank you, Chief Monias, and I think I can speak for us all in the room here today when I say we all stand with you in the search for our sister who is currently lost, and we all pray for her safe return back to the community. I would like to now call on our Bowman. Say a few words.
Good morning. Good morning, everybody. Bonjour à toutes et à tous. I really do appreciate the opportunity to say a few words. Merci de me recevoir parmi vous aujourd'hui. I too want to begin by acknowledging we're on Treaty 1 and Dakota Nation's territory and the traditional homeland of the Métis Nation. I want to thank the Premier, I want to thank ministers for the opportunity to join you today for today's provincial announcement. I want to acknowledge, of course, Grand Chief and Chief, of course, our Deputy Mayor and Acting Deputy Mayor, both who have been very strong in publicly promoting vaccines throughout our community. I appreciate your work. And of course, all of the healthcare heroes that are here, Dr. Anderson and so many others I know are on the front lines and are saving the lives of our residents each and every day. I do appreciate, as I acknowledged, I want to just say thank you to the Premier. This level of dialogue and collaboration is something that I think helps all the residents that we serve. We're all Manitobans, we're all Canadians, and our battle is against this virus. And today's announcement is very positive. I want to thank the provincial government for making this investment in our community and in other communities. This is an effort that we've never had to deal with before, as the Premier noted, and it's one in which everybody has a role to play. Government officials, healthcare heroes, but also our residents in stepping up and rolling up their sleeves and making sure that they're getting their vaccines. I too have been double vaxxed. My wife Tracy, our son who's eligible, our youngest son is looking forward to when he is eligible. He's too young right now. I have certainly heard the calls for freedom, the end to tyranny, and all of the other rhetoric that we see online, as well as in other platforms. Let's be very clear. There's nothing more tyrannical than a virus that ends a life, that limits our freedoms, that reduces our activities in terms of economic activity and just the freedoms that we all enjoy. And the path to freedom is by getting vaccinated. The path to freedom and restoring all of the rights and liberties that we all enjoy and want to enjoy is by making sure that we're protecting ourselves and our community from this virus. And so for those that are on the front lines, for those that are showing up and are getting double vaccinated in order to restore our freedoms and to protect all that we enjoy in our community, I say thank you. This announcement and the funds that are being made available is incredibly important because it's about reducing and access and barriers to access to the vaccines, and so it's incredibly important. I think Chief spoke very eloquently about how those in our community, some are disproportionately being affected, as they often are in situations like this, and so that's why these additional funds are incredibly important, and I want to thank the province for making them available in our community, to doing what they can to break down those barriers to access to the vaccine so that we can protect some of our most vulnerable residents. This is a way that we can also support the healthcare heroes in our ICU units. They are calling on us to do our part so that we can support them, and the way that we do that is for businesses and organizations to support these efforts, for healthcare heroes to have the support that they're getting with today's announcement. And so I would just say to those that might be the recipients of misinformation online about vaccines, go to trusted sources, go to protectmb.ca, consult your family physician. There's physicians here. But go to credible sources, get informed, and then roll up your arm and get the vaccine. That's how we restore our freedoms in our community. With that, thank you very much. I appreciate always being in this beautiful space, and just want to thank everybody for all their efforts and for the invitation of the Premier for today's announcement. Thank you. Merci, miigwech.
Well, thank you for those words, Mayor Bowman, and I think you hit the nail on the head. We're all in this together in our fight against waging war on a virus we can't see, but we have to deal with it, and we have to do our best. So I would now like to ask Damon Johnson of the Aboriginal Council of Winnipeg to say a few words.
This is a real opportunity to bring some attention to a major issue that's happening in Winnipeg around homelessness, mental health and addictions, and it's also part of the intergenerational trauma of Indigenous peoples in Canada, First Nations, Métis and Inuit, and in particular First Nations because they were treated quite differently than the other Indigenous groups. And that will have to be recognized within our process of truth and reconciliation, and in particular the truth, because we do not have consensus on truth as yet.
In April, our partnership with the Manitoba provincial government saw the opening of one of Winnipeg's urban Indigenous vaccine centers. In the 5 months we have been open, we have successfully administered over 22,000 vaccine shots and connected community members to resources and supports they need. We have a vaccine team comprised of 27 staff. Our staff are dedicated to providing compassionate, anti-racist healthcare and social supports. Dr. Barry LaValle, I want to thank you and your team. It was because of our collaborative efforts that we were able to mobilize a vaccine outreach team as well as provide primary care to our relatives on the street. So thank you. Also, Diane Redsky, Mumaway Executive Director. It was our sister agency's collaboration that further mobilized our vaccine efforts when we went to the North End and downtown Point Douglas neighborhoods. There we provided front door access to our relatives and community members as means to support vaccine education and uptake. Thank you. Hard work.
It took a lot of hard work for everybody to come together and make that happen. And, you know, and I really want to acknowledge it was the women from the community who came together and wanted to problem solve. And so, you know, our sister organization, Aboriginal Health and Wellness, and really the leadership and the support and the guidance and the encouragement through Dr. Anderson and Melanie McKinnon was just really gave us the hope that we could really pull this off. And as well as our provincial partners and committee who, you know, again, this was literally a day and night working weekends to make this happen. And so it was a real true dedication and a real co-development effort that was had by many people.
I would like to now to invite Dr. Marcia Anderson to share a few words with us.
It's really good to be here with all of you, and it's good for our hearts to be within this particular space, to hear the prayers of Sandra and Shane, thank you for this song, and to hear the Dakota and Cree language being spoken. You know, Pimachikamak is the community with the highest vaccine coverage in Manitoba. I'm pretty sure they also set the record from when the vaccine landed on the ground to when that first needle was in the arm, in a way that kind of surprised us a little bit. But that velocity kept going throughout January, February, and the early months. And as of yesterday, vaccine coverage for First Nations people living on reserve is over 90% without receiving it. And I think that is really clear evidence of the effectiveness of First Nations leadership, of partnerships. Mel and I are very thankful for the support of Dr. Postel and the university in supporting our work with the Manitoba First Nations Pandemic Response Coordination Team. There were a lot of meetings that I had with the Vaccine Task Force, appreciating our very collaborative relationship, and a lot of weekly Facebook Lives where we announced that 50 to 60% of people in hospital or in the ICU were First Nations people. As of yesterday, only 16% of people in the hospital are First Nations. And there is only one First Nations person in the ICU with COVID-19. This is a remarkable success of First Nations leadership and First Nations health, and of course the safety and effectiveness of COVID-19 vaccines. The vaccination rate for off-reserve First Nations has lagged, and in part because as Della and Diane mentioned, their urban Indigenous clinics didn't open until April. It took longer for us to leverage the same Indigenous leadership and partnership-based approach in the urban environment. But since that involvement, and since their leadership and operationalization, off-reserve coverage has also increased significantly and steadily, and is also significantly contributing to the reduced severe outcomes that we're seeing amongst First Nations people. I do also want to thank our federal partners for their role in this too, because their support was instrumental in standing up the testing site that Mama Wichita offers with the wraparound cultural-based support, which was a precursor to this partnership for the vaccine clinics as well.
But there's really, I have not much to say with such incredible speakers like my chief, Munyas, very powerful and emotive responses from the whole lot of you. What I do want to do is I want to acknowledge that there are people just outside this building who sleep in the cold. Sometimes they don't have food. Their risk of disease is high because the environment that they exist in actually diminishes their ability to even fight things like common cold or leg infections.
Thank you to all our guests here today, and to Sandra Delarond and to Shane Patterson for their opening prayer and song, and to all the speakers for being part of this important announcement.